Healthcare industry in US is very unique. It is an industry that has a price cap on its services. The federal government dictates the prices. And whenever there's a price cap, for example, such as a rent controlled, what happens is that the supply gets restricted and the demand goes up. Demand goes up because obviously the consumers don't have to pay for those services. And so the utilization and the usages of those services just skyrocket exponentially. That's why the United States gross health spending is so high. It's because of price cap and the fact that the consumers don't pay for those services. But the supply portion of it is very unique. In the old days, a doctor could charge a fee and see what the market demand was. So the supply and demand equalizes to a level where doctors' schedules will be filled enough at a certain pricing, but that doesn't exist anymore. At today's pricing, doctors are forced to see patients every 5 minutes. Without that, they cannot survive. No one can. Not in any specialties. Every specialty, maybe a few is still spared, but they're gonna get hit eventually. That's what those guys are studying in those departments and policy think tanks. They're just going after any specialties, any areas that there's still less of a price control than others. So what this means is that the only healthcare service organization that's going to survive is the one that has scaled up sufficiently enough that its overhead cost is minimum. For example, on average, solo doctor opening up an office just would not be able to survive. They would not be able to survive the labor law compliance, the billing compliance, the medical records request, the complexities of the economies and inflation and everything else that goes on. It is very interesting times, and I'll be speaking more about that in the coming few weeks.